Hi everybody, I hope you're all safe and well. Today I'm going to talk to you a little bit about bleeding gums and how you can prevent them. This video follows in a series of videos that I've made and shall be making of how you can manage common dental problems at home during this current period of lockdown. Bleeding gums. Well, the most common cause of bleeding gums, aside from actual damage to your gum, would be gingivitis. Gingivitis is the inflammation and bleeding from your gums. The most common cause of gingivitis is plaque. It's the presence of plaque on the teeth and the gum line which causes inflammation. Therefore, it would make sense that if you were to remove the plaque with effective toothbrushing and other oral hygiene techniques, you would reduce the amount of gingivitis and also reduce the likelihood of getting gingivitis. So it's the mechanical movement of plaque away from these surfaces that prevents it. The most effective way and most common way of this would be the use of your toothbrush. Correct targeting by angling the toothbrush head at an angle to the gums so that you cover the gum line will eliminate plaque from the tooth surface. Many people ask me, do I use an electric brush or a manual brush? Well, research shows that more efficient and effective toothbrushing occurs using an electric toothbrush. But again, you have to target the brush correctly in order to prevent gingivitis. The other areas you can work upon are the cleaning of your surfaces in between your teeth. Now, you could use floss, you could use something called little interdental brushes or TP brushes. These all help eliminate or reduce the buildup of plaque in between your teeth. You can use mouthwashes. There are a number of mouthwashes on the market. Chlorhexidine, or Corsidil as it's more commonly known as, can help reduce the onset of gingivitis. You must use it after you've brushed your teeth, but be warned, prolonged use of Corsidil can result in staining of your teeth. If gingivitis is not managed, then what can happen is, in some people, it can go on to affect the attachment of the teeth, and the attachment of the teeth is lost. This, if you like, is more commonly known as gum disease, or in the dental profession, periodontal disease. If left untreated, this can result in looseness of the teeth and subsequent loss of teeth. So it's very important to prevent gingivitis in the first place. So effective brushing with a fluoride-based toothpaste is your mainstay of treatment. There are other medicines that can cause bleeding of the gums, but you must check your medication information leaflet in order to see whether this is the case or not. Not all medicines cause it, so please check it. Some women during pregnancy suffer from gingivitis as well. This is more commonly known as pregnancy gingivitis. It's because of all the hormonal changes that occur in the body during pregnancy, making the gums much more susceptible to the effects of plaque on the gums. There is also an acute inflammation of the gums, which can be very painful and cause excessive bleeding and occasionally ulceration. If this should occur, you must contact the practice at your earliest opportunity. This requires treatment and sometimes can require treatment in the form of antibiotic. The name of this condition is acute ulcerative gingivitis. There are other ways of cleaning teeth more effectively, but if you can manage to brush effectively for 2 minutes, twice a day, using a fluoride toothpaste, and making sure that you cover all surfaces of the teeth, you are less likely to develop gingivitis. And if you do develop it, you're more likely to eliminate the gingivitis. A lot of people, when they suffer from gingivitis, tend to avoid the area and don't brush there. What happens in that case is that more plaque accumulates and the gingivitis gets worse. That plaque hardens off to become tartar. So remember, you must clean as effectively as you can in order to prevent this condition. Well, I hope you've managed to take something from that. It's a very, very brief description about gingivitis. Remember, if you do have any questions, please call the practice and we'll be able to discuss any problems that you may have or any queries that you may have in relation to many dental conditions. But until then, please stay safe, stay well, and we look forward to welcoming you all back soon. Thank you.